Hi guys, I am a CA here at Kalkstein Chiropractic. My name is Jayla and I'm here today with Kara, and we're going to be doing some laser on her frontal maxillary sinuses. Yay! Kara, say hi.
Hey there.
And her tanning bed glasses. And we switched up from, these lenses that we usually wear in our laser videos to these ones so we can access her sinuses, because if we wear glasses like these, we're going to be covering up those areas. So we're gonna get started, and Kara, tell me a little bit about what's been going on.
I've been having lots of sinus congestion as the spring weather tries to join us.
I can relate. I have really bad allergies.
And I've been very congested, and I also suffer from lots of migraines, and I think the congestion is causing some vertigo for me, and this was something that helped.
So vertigo is dizziness, for those who don't know. So Kara's been getting a little dizzy when her migraines happen, and the clogged sinuses have kind of bumped that up a little bit. More vertigo, worse headaches. So the laser is going to help kind of decongest the whole area. So laser is really good for inflammation, and those sinuses are inflamed. Which is what is causing the decongestion and all the, sorry.
Cut.
Alright. So with this laser, we're just hovering. For the other laser head that we usually roll it on the skin of the patient. But since it is more of a sensitive area and smaller area, we're going to just use the red light.
Can you still feel it being warm?
Yes.
And of course, let us know if it gets too warm.
But it's like pretty warm? It's still pretty far from your face.
Yeah, it's pretty warm.
That's crazy.
It feels good.
Is this the only head that you would use for this treatment?
We can also use another head that's also pretty small, but we choose to use this one because, as you can see in this one, the head, like the hole, is smaller. So this one gives us a little more access. So yeah.
But you would never use the rollerball one?
No. It would be kind of hard to roll that very large ball on someone's nose.
Oh.
Or near someone's eyes at that. So this one's just easier for us to get access to the parts that we need. And it's a little more precise because we can see where the red light is going. Have you always been coming to us for migraines?
Yes, since about 2.5 to 3 years.
What's been your favorite modality for the migraines?
Definitely the dry needling. It's been very helpful.
It's a very popular treatment for migraines anyway. Going to like the back of the neck, that's where the docs get it.
This red light is fascinating with the decongestion, as you can hear in my voice.
This is one of the cooler things that I found out that we can do with the red light therapy. Especially since we have these different heads, so we can switch the size and kind of choose what places we can go a lot easier because we have a wide variety of sizes that we can use, which is really nice. We use this head that we have on right here also for TMJ. So TMJ is when, like, in the jaw area, so that's like causing like tightness and clenching in the jaw. So we use the same thing for that area to help reduce the inflammation there.
the red light just for the sinuses?
No, the red light is used for all of our laser therapies that we use. You can see the red light in every head that we use. Just with the roller ball, we just have contact with the skin.
I low-key meant like for her treatment, is the laser like for the sinus issues or for the migraines?
Oh, for the sinus issues.
Okay,
Sorry.
just wanted to clarify that.
I thought you meant like that.
But I just let you go off, just for funsies.
Yeah, so the laser is for the sinus issues.
And then dry needling is for the migraines.
Yes.
Gotcha.
Yes.
You wouldn't laser a migraine?
No, I've never lasered a migraine. It's just a lot easier because migraines are usually tension, and the laser doesn't really help with a whole bunch of tension. It's usually mainly focused to help with inflammation. So that's why it's really good for the sinuses, because when you're congested and everything, your sinuses are very inflamed. Again, I have some history of that because I'm a very allergy-prone girl myself. So I've been to like allergists and ear, nose, and throat people who all tell me that as well.
Yeah, you're like allergic to almonds or something, right?
Allergic to everything.
Lame.
Yeah, very lame. I'm allergic to the air we breathe, aka all living things. So yeah, I have a lot of different allergies. But I'm still here today. Pushing through it.
To shock and wave. To laser.
Yes.
So is the heat like a byproduct?
Yes. The heat is a byproduct of the laser, or the red light anyway.
Because I feel like heat doesn't typically have inflammation. Question mark?
Yeah, so in certain cases it may, but for the laser, the idea of the laser is the red light kind of just breaking down those cells and like giving them some fresh blood supply. That's mainly what the laser does. And to give them fresh blood supply, it helps them kind of calm down and like just restart. Because a lot of times the areas that we laser on are areas that have been like struggling to like get fresh blood supply, or do what they're supposed to do. Those muscles are supposed to do in those areas that are supposed to just be working hard, like your sinuses, for example, are supposed to be clearing and getting all those infections and everything. And to help mainly any part of your body work better is to get fresh blood supply. That's like the best way to do it. And the laser is a good tool for that.
I'm sure there's a couple things. What makes this light different than those masks you buy with the red light on Amazon? I'm sure that one is much stronger.
Yes, this would
Like,
definitely.
does it even do anything?
I have never used one of those. This is the only laser I know, red light therapy I know, but I have heard people using like ultralight to do similar things. Do I know if they actually work from Amazon? I have no idea, but I know that this one does. And I think that the ones that are on like Amazon are UV lights rather than like red light. I think they're a little different, if I'm not mistaken.
I was telling all my coworkers and friends about the red light, so then naturally, all the social media is going to be like, buy this red light on Amazon. I'm like, that's not quite right.
I think they still they try to promote it as it does still create like fresh blood supply and everything. I'm not sure if it actually does. Don't quote me. Carly, have you ever had laser before?
I think so. A little bit, maybe. I think a little bit.
You think a little bit?
I think so.
I'm personally waiting for the next Carly actually in a video. What do you think that would be?
She's not real, so I don't know.
She's not real. She's
not
a
real.
background character.
She's just a figment of your imagination.
Gotcha. I'm talking to no one.
I'm just a disembodied voice. That's all I've ever been. So like if your sinuses are clogged and you laser them, do you think you could like unclog them after treatment? You could just like blow your nose and be completely clear?
I know that Mr. Christian on the exercise floor has gotten this and has claimed that he could breathe like no other afterwards. So I think if Christian said it, then it just must be true. But what do you think, Kara? Did you think that you saw an instant difference afterwards?
I don't know about instant, but definitely the next day is when all the drainage like made a big difference in my voice and everything, and I was coughing a little bit more, which is a sign of drainage too. So it definitely helped me to breathe. So that was nice.
So I guess the answer is yes, Carly. All right, laser is all done. It's nice and warm for you. I can have your tanning goggles now if you want the world to see your eyes. What? Face reveal. All right, and then we're all done with the laser today. I think we're gonna move on to some dry needling next.
So, hey everybody, it's Dr. Warren. You guys got to watch the laser treatment here, where you do something really cool, which I learned about last time. Sorry if I'm talking too softly. It's called Hippotherapy. I had to repeat myself a couple times last time. I was like, what did you say? What kind of therapy are you doing? And she does, so it's like, let me have you explain it relative, but it's so cool that she's doing it, and I've heard a lot of this through the grapevine of working with people over the years of this like therapeutic approach using horses, and so talk a little more about hippotherapy.
So I'm an occupational therapist.
She's an occupational therapist, yeah.
And I use horses in my therapy to work on my clients' goals, so their therapeutic goals. Sometimes it's more mental emotional goals, and other times it's more of the physical and mechanical goals, just kind of depending on the client. And so I'm using the horse as a tool to kind of help me work on our goals in therapy. And horses and lots of other animals have great benefits to providing counselors therapies.
Yeah, that's awesome. So, using a horse to reinforce gait mechanics to somebody while they're walking on it, and that rhythm and that feedback, like I don't understand the intricacies of that, but I've really heard that to be very beneficial from a mental standpoint, and giving that emotional release of connecting with an animal. And then, you're working with kids too, so it's probably, you just see it unravel right in front of you. There's so much joy in that moment with kids, which is really special. I've heard a lot about that with people that are recovering from cardiovascular events too, people that have neurodegenerative disorders, and using horses to help aid in that. Kids or people on the spectrum, or with mental impairments or mental challenges, if you will. All those, it's pretty cool how many people you can serve. I love riding horses too. You can serve me too. I'm gonna come up there and get some hippotherapy.
Let's do it.
Let's do it. Oh my God, my daughter lights up on the horse. It's so cute. And so we traveled down to Costa Rica, went to this beautiful place down there called Capos. And Capos is a little city. It's near San Manuel Antonio National Park, and went to Dominico. And just there's such beautiful areas down there. We go to the beach, and this is probably like how old do donkeys get? He was up there, right? This donkey was
20s.
Living his best life on the beach down there, though. But my dog, what was the name of that donkey? Clementine or something like that. And Scarlett, lights up. It's like the most beautiful thing she's ever seen, this little donkey. And we get to the beach, and it's like, Layla runs to the ocean. I'm like, oh God, I can barely swim, gotta go after that one. Scarlett's sitting there petting a horse, some wild horse on the beach. I'm like, oh my God, what's going on? Marley's asleep. It was wild. So the guy's like, do you wanna ride? And I'm like, yeah, totally, she would love that. She rode around on the beach for like 10 minutes and she talked about it all day long. It was so cute.
Good.
Yeah. She had a great time.
She had her own hippotherapy.
She totally had some hippotherapy. And I know you're directing that, and I'm probably using that. We're using it loosely now, relative just to all horseback riding, right? But I know that there's an approach and there's a technique, and you're up in Baltimore County, right?
I'm in Howard County, yeah.
Sorry, you're in Howard County. Oh, you are? Okay. I feel like most of the farms around here are up in northern Baltimore County, so I'm surprised
there's a couple people that do that, and it's awesome, and I'm glad that it's growing in interest because I think it's very beneficial. And so.
That's awesome. I appreciate you. Doing some trigger point therapy on the shoulder, on the rotator cuff, infraspinatus. I'm gonna get to the supraspinatus, the teres minor, and now I'm working on her upper trap because you'll find some of those reflexive trigger points in that area where she's straining her shoulder. There we go. How do people find you if they want to use your services?
I have a cute website and a little social media page.
Carly's gonna tag it on the top comment here.
Alright.
Yeah, so if you've got an individual or somebody that you think could benefit, or if you just want more information on it, check it out below. Sure. So you've been getting dirty about 3 times. We're going to use some stem. You come to the room, we'll do some soft tissue work, some adjustments. Last time you were in, we did some sinus releases. You got the light therapy.
Yeah.
Sometimes I'll also dry needle in conjunction with the, I'm in a super tight spot. With the laser therapy, I'm going to the spine of the scapula. And I'm working over the belly of the supraspinatus muscle, palpating the turf, minor sensory point, and here, pressure point, whatever you want to call it, Ashi point. Ashi point is in acupuncture. I think it means, oh god, they told me it meant it hurts here. But that's like a name for like a meridian point as well. A lot of crossover between acupuncture points and trigger point dry needling. Probably a reason for that. You doing well with all these so far?
Yeah, I feel good.
They feel good? Awesome. You let me know if it's too much. I'm trying to give you space and me space. Let me do this. Stop matrixing myself. There we go. Just fanning the needle, just working the needle back and forth before I let her sit with these for 10 minutes. And it kind of looks wild, like to see a needle kind of sliding back and forth like that. And it's I'm on purpose doing that in the sense of creating some stress in the tissue. Lateral deltoid. But the needles don't cut, they push. They slide through the tissue. They're not beveled like you would get blood drawn.
Where's Eddie? Oh.
She can handle some dry needling though, there's no doubt about that. That's not like easy to like throw. She's making that look way easier than it is. I'd be like, oh!
But I'll take it.
So working on the rhomboids, working on the levator scap, lateral delt, all these different tissues around the shoulder, no pressure there. And then I'm going to hook up some stem to her as well, to the needles I should say, which will stimulate that tissue. It'll drive that endorphin response in the tissue a little bit more. There's pain relievers that come in with dry needling. I kind of equate it. The scientists of the world might refute what I'm saying, but it's just an easy way of understanding it. It's like adding heat to a chemical reaction. It's a little bit more work to that tissue in a positive way. So, relative to that, let's get working. Electrical stimulation is used a lot in physical therapy and in chiropractic care in different forms, and acupuncture as well. Acupuncturists tend to, when I use this in school, have like a little pen they'll hold up to it and stim one at a time. These are really, really awesome machines that we have here that do a great job of maintaining a good current. We're going to use a low frequency with her shoulder. It's not something that she injured yesterday. And so I'll set that frequency accordingly. So it'll feel like more of like, that's what it's done. Like, one more of an acute setting, I'll increase the frequency like that. Other than stim noises sound to you, okay? Was that spot on?
Yeah. Well, good sound effect.
Yeah, try. Alright, nice and easy. We're going to work the trap and supraspinatus first. You're going to feel a little thumping. We got some action there. Carly, check it out.
They're dancing.
Look. You broke the fourth wall. Oh no, that's when you talk to them. Oh, you can talk away. You're good. I love when you talk. So we're going to turn that up a little bit more. Let me know when it's strong but comfortable. It's already kind of right there where I would like it. Do you feel good with that level?
Yeah.
Okay. Strong but comfortable, like I said. Don't want to be sitting back playing patty cake with these. We need some work done, but we don't want it to be uncomfortable. So we're going to go to the teres minor and infraspinatus area, mostly teres group. And you're going to start to feel a little stim.
Dang.
And I'm liking how that's moving right there too. You okay with that?
Yeah.
You feel that?
Yeah.
All right.
How could she not feel that?
You'd be surprised. Sometimes people don't. I'm like, okay, we need to turn this down. They're like, yeah, I don't even feel it yet. I'm like, your muscles are jumping off the table. So sometimes awareness in an area is different from person to person. That's a side story for another day. We're talking about hippotherapy here. We're talking about someone that's giving back to some people in a cool way, in a good way, and we're getting her ready for the big day.
Thank you.
Do some soft tissue work and adjustment next. You chill for 10 minutes, okay? So. There are a lot of muscles in the base, like a lot, a surprising amount, to create all these facial expressions that we have, and so I'm going to be doing some work on some of those muscles. Right? And then I'm also going to be working on some sensory points that will cause reflexes to help with some range. You can do this on your own very easily, and I usually tell people in the allergy time, it's like, you don't just have to take Allegra, there's other ways of working on some of those things, and this is one of them. Oftentimes I'll just have to get like a really kind of intense, like, okay, just get face wash and then just work these areas that way in a hot shower. It's like a great time to do some self sinus massage, relaxing. get into working on the maxillary sinuses. My oldest is like 3 now. She's starting to request like she got gray because she wants me to work on her neck and stuff like that. And her awareness is actually like surprisingly good. Like she's like, Dad, the right side of my neck is feeling a little tight. And I'm like, okay. Like she just like kind of get me to work on her, just like kind of get an attention. I'm like, oh my gosh, actually the right side of your neck is actually just a little bit tight. You're not too far off on that. I've given lots of baby massages recently, like a ton, and they love it. My 11-month-old, I'll like massage her back a little bit while she's like falling asleep, and just kind of gently work on it. And like connect everything. Together, teeth apart, the tongue to the roof of your mouth in there. And just relax it. There we go. Gently open your jaw. Go. Good. And relax. Gently open. This is Flex Balm. Carly, we tag it. It's good stuff. Don't get in your eyes. Your neck and chair in just a second. But first, I want to work on your mid back, okay? Let me get you the tissue. talk a lot in videos and explain what I'm doing. I'm just not doing that in this video. I'm just trying to give her a relaxing experience, so that's why I'm not speaking a lot. You're welcome, of course. You can relax on your stomach here for me. This is like the soon-to-be newlywed experience. We're just trying to relax, okay? Got enough things going on, alright? Don't need to worry about, you know, the YouTube video in the back. We're just here, okay? Scrubs. These just, you can't move in these things. You can go back to the underarm. Feel that stress on there. Take a deep breath in for me. Exhale. And easy out, rest your shoulders, relax your head. Let that pressure fall. Good. Good. Easy. Nice. There you go. Nice. Good.
Yeah.
Awesome. You can sit right there for me. So you're in occupational therapy now, right?
I am.
What hospital are you working at?
University of Maryland.
Nice. What population?
I see adults in the psychiatry unit.
Do. Good for you. Turn left for me. Turn right. Stand. Good. You move relatively well. We'll work on that right there, okay? Pressure. Good. Settle your shoulders. Good job. Be gentle on this side, okay? More gentle. Just pressure. Pressure. And settle. I got you. There's the release right there, okay? Tension. Easy. Gotcha. All good?
Yeah, it feels much better.
Wonderful. I hope you have a wonderful day. I really appreciate what she does, if you can't tell already. And it's cool. We have really good patients here, fortunate. But yeah, sometimes people are hurt and they're in pain. It's hard to work with them. She's a joy to work with. Like, it is an absolute pleasure to help her out. So I'm so excited for her future. I love the connection to the office with some of our past employees, Dr. Alec and her, our friends at Towson. And we got like to appreciate his smart ways and his ability to understand the topic and go into it. So we were talking about that last time, but yeah, so grateful to work with you. I hope you feel better.
Yeah,
thanks for watching.